And we must.
Okay, everyone. I'm going to call this meeting to order of the Franklin Regional Council of Governments. And our first order of business is roll call. And Rebecca will say your town and just address aye or yes.
I think we have a quorum, though I do not see Greg Snedeker.
I'm here.
I saw him. Yeah, he's there.
I'm here.
Who am I thinking? Not Greg, Steve Ellis.
Yeah, I don't see Steve either.
So we might be one short, but shall we try it?
Sure.
Okay, Ashfield.
Here.
Bernardston. Buckland. Charlemont. Coleraine.
Here.
Okay. Conway. Deerfield.
Here.
Irving.
Here.
Bill's here, no?
Here.
Okay.
Yeah.
All right. Gill.
Here.
Greenfield. Greenfield.
Yes, here.
Okay. Holly. Heath. Leverett.
Here.
Leiden.
Here.
Monroe. Montague, are you in yet? Not yet. Oh,
Did you get Greenfield?
yes, I just heard a dinging. That wasn't Steve, was it? No, okay. Sorry. New Salem,
Here.
Northfield, Orange,
Here.
Rowe,
Here.
Shelburne, Shutesbury,
Here.
Sunderland, Warwick. Oh, no Sunderland. Oh, we may not have a quorum, folks. Warwick, Wendell, Whately.
Here.
Oh, good. Bill Pearlman, are you here? Jay, are you back?
I'm here.
Okay.
I'm back.
Jim Bassford.
Here.
Okay, we do have a quorum. 18 folks and 79.212% of the total weighted vote of the council hit it.
Yeah.
Nice
Okay,
job.
thank you, Rebecca. Every July, the council holds its annual reorganization meeting, voting to elect officers for this body and to appoint members to the executive committee. A nominating committee meets to discuss and recommend the members for the offices. New this year is the council's responsibility to appoint Transportation Planning Organization members, TPO, for those of you who are reading off your paper. The Transportation Planning Organization is responsible for overseeing transportation planning activities at the FERCog and is comprised of state, regional, and local representations. Local representation includes members representing the western, central, and eastern regions of the county. As Franklin County's largest municipality, Greenfield holds its own voting seat. A nominating committee made up of myself and the council's two regionally elected members, Jay DePucchio and Bill Pearlman, met Monday afternoon to discuss possible nominations. We recommend the following slate of officers. Chair of the Council, Trevor McDaniel of Deerfield. Vice Chair, Greg Snedeker of Gill. Secretary Clerk, Kevin Fox of Coleraine. Council appointment to Executive Committee, Greenfield Mayor, Roxanne Wiedegardner. Council appointment to Executive Committee, Kevin Fox, Coleraine. West County Transportation Planning Organization appointment, Heather Butler of Buckland. Central County TPO appointment, Steve Ellis of Montague. East County TPO appointment, Gabe Volker of Orange. Are there any other nominations from the floor? Okay, is there a nomination to close?
So moved.
Second, Trevor.
Trevor seconded, okay. So the motion will be to cast one ballot for the slate of officers as presented by the nominating committee. Are we going to take a roll call for that, Rebecca?
Perhaps use Jay's idea of asking if all in favor, and if there are any objections, maybe we can roll call.
All in favor?
Aye.
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 Are there any objections? Does anyone want to discuss anything?
Steve just showed up. Steve just showed up. Did you hear, Steve? That it was slate of officer.
Yes, I was going to abstain, and then I was concerned that I was going to force a roll call vote on what was apparently otherwise a unanimous vote. So,
Okay, it sounds like it was a unanimous vote, right, Rebecca?
Sounds like it was.
Okay.
With
And I
Steve.
would like to thank everyone for the opportunity to serve you as chair of this wonderful council and organization. We are truly lucky to have a voice for regional services. I will now hand over the reins to Trevor McDaniel.
Well, thank you all very much. I really am humbled by your support to have me run as chair this year. So I'm very excited to do that. One quick question before we get going with Steve.
Hey, Trevor,
Yes.
this is Stan. I just joined in.
Oh, Stan, great. I was going to say, was Stan here? And Steve, do you know what our percentage is now for voting? Does it matter, or is it as long as we have a quorum, we're good?
Oh, we're way over quorum. Yeah, we're fine.
Trevor, could you speak closer to the mic, please?
Either
Yes,
that or
I-
turn up your
yeah.
volume.
Or turn up your volume?
Yeah, let me try that. Is that any better?
Better.
I'm
Better.
full blast. So I'll speak loud. So, thank you again very much for allowing me to chair this year. I'm really excited to learn from you all and work with you on important business. So I've got I think the first order of business here was to adopt the minutes of May 21st, 2020. And
I move that the minutes of May 21st, 2020 be accepted.
Ellis seconds.
great. Thank
I'm
you,
sorry, who seconded?
Steve Ellis.
Steve, thank you.
And all those in favor?
Aye.
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 Any
Plus one.
one?
That's
Okay,
funny.
great. So move those are a unanimous vote. Thank you. So we have a council update, and I'm told to mention we have so our FY21 council meetings. FY21 council meetings will be held via Zoom until we can safely meet again in the Transit Center. Please mark your calendars with the dates of your FY21 meeting schedule. So our next meeting after this would be October 15th, 2020. The following meeting will be January 28th, 2021, with a snow date for February 4th. And then our final meeting would be April 15th, 2021. So we also want to welcome new council members. Not all towns have made their appointments to the FERCog Council. As of this writing, we will plan to announce and welcome new members at this evening's meeting. And I'm not aware of the new ones. If anyone else wanted to chime in, Rebecca?
Well, we do have, as I said, we did have a little switch around, and Jen Morris is now here for Ashfield, and Janice Boudreau, who was an alternate in Rowe for several years, is now the rep from Rowe, I believe. But
Okay.
we have other towns who have not appointed, so
Okay. So
more
we'll
to
wait
come.
on those. Great, more to come. And then we will hold a Zoom orientation session for new members that will outline the responsibilities of the council as well as review our operations and finances. All council members are welcome to attend those sessions, and I'm sure an email will come out with those dates. And let's see. So the executive committee update, if I guess it was the next on the agenda.
All right, this is Jay Dupucci. I'll take that here. For those of
Thank
you
you,
watching,
Jay.
if you notice, if I lean back a little bit, I've got a little Tin Man hat on. See
Yes.
that?
You do.
Okay, I'm gonna try to keep that right there. All right. The executive committee convened twice as the Economic Development District Governing Board. We actually met a few moments ago to approve some final minutes to move the acceptance of that along at the federal level. The new 5-year SEDS plan serves as a roadmap for strategic partners to advance policies, programs, and projects region-wide for economic opportunities for all and contributing to the well-being of Franklin County communities. Jessica Atwood is our staff person who's been handling that, doing yeoman job pulling together an enormous amount of information. I'm sure many of you have participated and contributed both information and comments to the draft and assisted her in that effort. And thank you all for that. We've discussed the current and continuing role of the COG during and following the Franklin County Emergency Communication Systems transfer to the Commonwealth's interoperable, many syllabic, radio system. And we've authorized a letter expressing concern regarding the Trump administration's changes to the NEPA National Environmental Policy Act that significantly reduces the rigor of requirements. We've met several times with the Finance Committee, as you can imagine, concerning COVID response this year. Some of you were present at the last council meeting where we discussed some of that. The COG has proceeded with the PPE purchasing program for municipalities and businesses that was discussed at the last council meeting. I imagine there'll be some more detailed update about that later in this meeting. And of course, we've been meeting with staff and other committees to deal with the COVID-19 pool of benefit time for staff that are trying to work from remote. So with that, I'll put my hat back on and turn the meeting back to you, Trevor.
Thank you. Thank you very much. And I would next on the agenda is executive director update. Linda.
Hi, everyone. I won't move much in my room because it looks like I have artwork behind me. That's the only thing that's left in this room. Everything else is packed boxes.
Wow.
Because I am moving in a few weeks. So I
Oh,
just am fitting in this little space around boxes right now. So first thing I want to tell you is remind you that we are doing an organizational assessment study of the COG, and that's going to help us figure out, we talked about this earlier, that the COG's administrative structure has evolved, perhaps not as thoughtfully as it should have been. It's been really more of a reactionary evolution with our growth. So we're going to slow down and look at how we should be organized most efficiently and effectively, especially as we see upcoming retirements on our horizon. We have hired Community Paradigm Associates, and that is led by Bernie Lynch. I imagine many of you who have been to the MMA annual conference know Bernie, and he has brought on 2 local people to be on the team, Deb Radway and Bernie Kubiak. They are doing one-on-one interviews with, in the council updates, I talked about focus groups. They've changed their minds. They are going to do one-on-one interviews with several staff. They would like to do one-on-one interviews with all of the members of the executive committee, and then would welcome any other council member who would like to talk about the COG and how we function and how we could function better, et cetera. So if you're interested in that, please let me know. And we will get those interviews scheduled. They have started scheduling interviews now and hope to be done with that. I don't know, we got a little delayed by COVID, so I'm not quite sure. I think we hope to be done by December 31st. So let me know about that. I'm gonna pause for a second and let Phoebe jump in since she's in the meeting to talk about some municipal advocacy we are hoping for, and then I'll come back.
Hi, folks. I'm hoping to draw your attention in your document to page 4 and the municipal support requested for strengthening local public health system. You don't have to look at it now, but as it says, over the last few months, one thing that's become really clear in the pandemic is that Massachusetts' system of having a completely unregulated, totally decentralized and underfunded local public health system didn't actually turn out to serve us all that well. For many of us, we have, your communities have pretty strong local public health systems, but across the state, it was dramatic, the difference in levels of protection for people. So a group of us on the Coalition for Local Public Health are pushing really hard with the assistance of our legislative delegation for the state to finally join the other 49 states and start funding local public health as a core government service. I'm asking for your support of that by clicking on that link there. There's a municipal leader sign on. It doesn't have to be an official vote. It's just names of people in municipal leadership roles who say that this is important. So I will follow up after this meeting as well. But if you just click on the hyperlink in there, that would be great.
It was very easy. I did it before the meeting and quick and painless.
Thank you, Trevor.
Thanks, Phoebe. So much of our work of the spring was assessing if we were going to be able to meet our grant requirements because of COVID. And we spent a fair amount of time advocating for extensions to our municipal vulnerability grants and our hazard mitigation grants. Both of those grant programs require such intensive public policy and public involvement that we really wanted to get extensions so that we could figure out how to do meaningful public engagement on this platform now. And so we did get extensions for all those grants, and you should be hearing from our planning staff soon on how we're going to get public involvement. And since we have so many staff with us tonight, I'm pausing again for Jessica to jump in and talk about the 2020 census.
Hello. So the 2020 census is still underway. There were some delays in some of their outreach and some of their procedures, but it's still happening. Franklin County is actually doing really well. We are pretty on track. As of yesterday, we had 68% of Franklin County households had self-responded, and that is 4 points higher than the state and 6 points higher than the nation. However, we still have some households that need to respond. We have until the end of October, but the sooner you do it, the less mail and bothering you will have at your house. It's been particularly challenging in some of our rural areas, particularly in West County, and the towns of Charlemont, Hawley, Heath, Monroe, and Rowe. The drop-off of the survey forms were delayed because the Census Bureau stopped or ceased field operations for a period there because of COVID. But hopefully by now everyone has gotten their survey, or they should be getting it very soon. If anybody in those towns would like some help in kind of doing outreach, I have sample articles, I have sample social media posts, any of that kind of stuff for those Charlemont, Hawley, Heath, Monroe, and Rowe. Please let me know, and I can look up right now who gets the gold star. Deerfield, 78% self-response. Leiden, 76. Berniston, 75. And Leverett and New Salem each have 74. So you guys are outpacing everybody.
Wow.
That's it.
Thanks, Jess. Thanks for not telling us the lowest response town. So one of the biggest things we were worrying about last year was if we were going to be able to successfully merge the collective purchasing programs of Hampshire County and Franklin County, which was quite an effort, but isn't that something? That's what our biggest concern was at the time. So we did do it. And our highway program expanded from 25 towns to 51 towns. Our fuel program expanded from 20 towns to 33 towns. We got great pricing on fuel. and have really managed to figure out how to expand that program. And it has been great for our staff, and they should be applauded. We are working on water and sewer issues, and one of the things that we've really been trying to focus on is the issue of scarcity of water and sewer certified operators. It's been a hard thing to work on with DEP because DEP is in the dual role of wanting to help us, but also being responsible for making sure that systems are being checked and cared for properly. They have certainly recognized that they need to help us with this issue. And so with DEP and with UMass, we have expanded an operator training program. They did an online program and gave scholarships to Franklin County residents who were willing to take the program. They're going to offer tutoring assistance on the testing so that hopefully we are expanding capacity of water and sewer operators in the county. We've also been working with UMass. They've surveyed all of our water and sewer system operators, so we know what their needs are. And more importantly, we know where we can do some matchmaking, where we can have shared operators. So we hope that we have some significant improvements to report soon on that topic. I'm going to move to the emergency communication system. The last time we talked, there was some concern about our transition and migration over to the state's emergency communication system because there was a fear that there might be a capacity problem. There indeed was a capacity problem, but the state has invested about $500,000 to expand the number of channels serving Franklin County. So that has been taken care of. They have created some computer generated maps of coverage, both what they consider our existing coverage to be and what their current coverage is before the expansion of the system. There are some problems with those maps. The most significant problem is that they assume that our system is working optimally. Not only that all of the equipment is working, all of the towers are functioning, but there is also no disruptive interference, which is a big part of our problem. We actually have too many towers and the communication bounces off of each other and causes interference. So we will be sharing those maps with all of the towns, but before we do that, we're going to go out and do some field testing so we can compare and validate the maps because the maps of our system look a little too good right now. The other thing, remember, we've talked about this before, the intention of the state is they're going to give the COG a grant, and that grant will be used to buy radios for every municipality. And the municipalities will be given an inventory of the number of radios that the state will supply, and then towns can determine if they want to upgrade their equipment, add equipment, or expand the number of radios. That got delayed because of COVID, but we do expect that process to start up very soon. And instead of radio purchases happening over the course of fiscal year 20 and 21, instead now it's going to be compressed all in FY21. So as soon as we have the coverage maps fixed, as soon as we have the grant for the equipment, and we also have negotiated a memorandum of agreement between the Council of Governments and the state, we will hold another big regional forum, likely by Zoom, our favorite platform, to talk about this and to begin that migration process. We hope we're scheduling that for August. Local official workshops, we canceled the March workshop and we're working to figure out how we can have some good quality workshops via this platform. We know that people are already getting a kind of some Zoom fatigue. So we're going to try to figure out how to create workshops and trainings that are good, that are meaningful, that you want to attend. In a future meeting, because I don't want to take up too much time, we will talk about 3 significant public health grants that we got. I will ask you to read about them on page 11. We got an Advancing Racial Justice grant, Addressing Abandoned Housing grant, and then a grant for us to update and continue the work of our Community Health Improvement Program. And do I have anything else? Yes, I do.
question.
Yes.
Can you tell me more about the racial equity or the grant that you referenced?
The Advancing Racial Justice one?
That is it, yes.
It is, we actually have 2 grants, one that we are the lead on. This is looking at advancing racial justice specifically in the Franklin County school districts. And then we got another one, Steve, that was you, right?
Yes.
We got another one where we are working with the Franklin County Community Development Corporation. They got a grant called Welcoming and Belonging Franklin County. And that project is going to look at how we improve racial equity, not looking specifically at workplaces, and then expanding that out to improving racial equity and racial justice in the county. And we do not have the contracts yet, but we have negotiated scopes of work. We can send you the scopes of work if you're interested.
Yeah, I certainly would like to remain engaged and apprised as the process moves forward. Thanks.
Yep. The only other few things I will say is that I hope you are all aware of MassDOT's Shared Streets and Spaces grant, which is to make outdoor dining and outdoor shopping a more pleasant experience. MassWorks, that grant is out. That's how our towns get STRAP and other economic development funding. Those applications are due on my mother's birthday. I'm sure you all don't remember that that's August 28th. And we are doing a limited traffic counting program if you need any traffic counts. And we have created and accepted a marketing program for the Valley Flyer rail service and have just put that on hold. Right now, nationally, Amtrak ridership is down about 95%. We have 1 train a day still serving us, and the service will gradually increase as consumer confidence increases. So Amtrak will be monitoring how ridership looks across the country to decide when to add more trains. Our current hope, fingers crossed, is that we are launching the marketing campaign next April, and we will do a hard look at the conditions of the pandemic in January and decide if that timing is correct. And finally, we have hired a new staff person, Kydra Jacobs, and I honestly have not met her in person yet. I've only met her over Zoom because of the pandemic, but we welcome her to the COG. I am finally done.
Thank you.
Thank you, Trevor.
Appreciate that. So any questions from anybody before we move on? The next item would be a planning board update, although I don't know if they were met. So that would, Jim, is Jim on?
Yeah.
Oh, hi.
Okay, I'll be brief. I hope you can hear me.
Yes.
The planning board endorsed the comprehensive economic development strategy, which is the regional economic development plan for Franklin County at its June meeting. And probably more importantly, at our next meeting in September, the board plans to explore the issues related to tiny homes that can provide an affordable housing option. And we'll also look at zoning related to solar facilities. And that's pretty much what we have at the moment.
Thank you. Thank you very much. There's a finance committee update. Lynn Sibley, is Lynn on?
Yeah, I'm here.
Hi, Lynn.
Hi. The Finance Committee has been analyzing this year's the end of the year status. The accounting program and the purchasing program both overspent their expense budgets, but that really is not a surprise. And the finance committee will be rectifying those deficits at a meeting next week. The inspections program, which we were kind of worried about given the COVID-19 issues, actually did end up ending the year strongly. They had a few big permits and the revenue is going to hit in FY20. So hopefully that will continue. And Linda also reports that the staff is still working a combination of home and at the office, occasional trips to the office, mainly at home. And it seems to be working okay and things seem to be getting done. And just a reminder that the FY21 invoices have been sent out. If anyone doesn't have their copy, just get in touch with Claire and she'd be happy to get you another copy. And lastly, the good news is FY20 has actually ended on a very strong note. Preliminary numbers put our surplus in the range of $200,000. So once we officially close, the finance committee will sit down and evaluate options for that surplus. And some of that may have been the results of some additional grants that came along the way, especially given all the COVID grants that are out there and the indirect rate that helps things out. So I think that's about all the finance committee has.
So would we, just a question on some of that. So would we typically get some accounting or reporting on the money that came from the state for COVID? Yeah, is it related to the health program? Some towns got their money directly. Some towns, such as Deerfield, who belong to this group, went to FERCog. We would love an accounting of that to know what.
Yeah, I think that's something that Claire can provide at some point. So
that'd be great.
I'm also about to talk to you about it in a little bit.
Oh, that's perfect. Oh, thank you very much. Yeah, I'll wait.
May I ask when the next planning board committee meeting is?
The next what, Ellen?
The planning board meeting, because they mentioned they were going to deal with zoning and solar facilities.
They meet on the fourth Thursday, but I can't remember if they meet in July. Do you remember, Jim?
Not till September.
Okay.
Okay, thank you.
It should be September 24th.
Thank you.
Oh my God, that's my birthday. We've talked about my birthday and my mother's birthday.
Everybody put that in the calendar. Okay. So thank you very much, Lynn, for that. So our next agenda will be the FERCog COVID response, and we have four areas. And bring that over to Phoebe or Jessica. I'm not sure who's.
Let me jump in first and say that we thought you'd be interested in getting an assessment and summary of the work we've been doing related to COVID. I am impressed and proud of the work that we were able to pull together and how we were able to flexibly change course when the pandemic hit. And we thought we would start with Jessica because Jessica has been doing the work of looking at the data to see what the impact of COVID has been to Franklin County and to our labor force and our workforce. So Jess, are you gonna do a PowerPoint that you're gonna pull up?
But of course.
I knew you would.
I do like my PowerPoint. Okay. I'm going to pop into.
She likes Excel better.
I do love Excel. I'm going to pop into the screen share right now, and if there's any questions, just pipe up, and I can respond. So let's see. So I'm going to start off with just a quick snapshot, kind of pre-COVID of where Franklin County has been. 2018, our population estimate was about 71,000 people. Over half of our population is aged 45 years or older. This is higher than what you see at the state level and at the national level. We have a lower percentage of our residents who work in private for-profit businesses. We have about 2,500 employers located in Franklin County. That does not include self-employed. It doesn't include a lot of farms, though. The average annual wage of workers who work at those employers in Franklin County, that average annual wage is the lowest in the state compared to all 14 counties. So here we have the monthly unemployment rate for Franklin County from January 2018 through May 2020. There is the usual cycles. It's been a very low unemployment rate. As of March, it was 2.9%. And then when it came to April, it popped up to 14.2%. Oops.
Terrifying.
Comparatively, when you're looking at the size of the labor force, again, this is monthly from 2018 through May 20th. Now, the labor force includes those who are employed and those who are actively looking for employment. And we can see that how that dropped from 41,000 in March down to 36,000 in April. I'm going to be very curious to see what the June numbers are when those are released. This is not just for Franklin County. This is for the Franklin, Hampshire Workforce Development Area. So this is our Career Centers service area. It includes Franklin County, Hampshire County, and North Quabbin. So these are initial unemployment insurance claims have been filed. So again, you see the usual cycles, and then in April, where it pops up considerably. Two things I should point out with this data that makes it a little bit wonky is that under the CARES Act, though the pool of applicants who can apply for the UI and benefits was expanded to include independent contractors and self-employed and other folks who are usually not allowed to apply for that. The data also may or may not include fraudulent initial UI claims that were filed. Both state and the federal governments announced that there had been a data breach some time ago, and some of that personal data has been used to file fraudulent claims. So all of this information, as well as some other information, is highlighted in our 5-year comprehensive economic strategy plan, which you've heard a couple folks mention. It was just approved in June. We also put in various thoughts because we were developing this over the past several months when COVID hit. So we've highlighted different sections of the plan to identify what is specific to the COVID situation. So Franklin County, Franklin Regional Council of Governments, we are an Economic Development Administration, EDA, designated Economic Development District, EDD. The CARES Act allocated $1.5 billion to EDA programs to help communities respond to COVID-19. It opened a new round of funding for construction and non-construction projects to apply to. Those projects need to be aligned with that SEDS plan I was just talking about. And because the FERCOG is a designated EDD, we were invited to apply for a supplemental planning grant for up to $400,000. We applied for that last month. We are waiting to hear, it should be any day now. What we applied for was 4 items, basically. Doing an economic recovery and resilience plan, which would have FERCOG and our partners such as the Workforce Development Board, the Community Development Corporation, the Chamber of Commerce, and others, to look at how we have responded to the crisis in terms of the business community and our economy. What can we learn from this experience? What went well? What hasn't gone well? What we should improve on? And so we'll be working on that plan. We also have funds to hire a contractor to do direct business technical assistance. So that is one-on-one business counseling, workshops, whatever may be needed by our businesses and nonprofits. We're also going to be looking to fund a county-wide water, wastewater, critical infrastructure study.
Thank you.
And then also it'll fund staff time to help project advocates move forward with their EDA applications that are identified in the SEDS. Similar to FERCOG, we were invited for supplemental funding. The Franklin County Community Development Corporation was also invited because they're a past EDA award recipient. They were allowed to apply for, and they did, up to $730,000 to recapitalize one of their small business revolving loan funds. I haven't heard the outcome of that application yet. So, that is my update.
Thank you. Those are frightening numbers. Really frightening numbers.
Does anyone have any questions for Jess on that?
When do you expect to hear on that grant, the $400,000 grant?
Any day now. We heard it's a non-competitive grant, so that's the good news. And so we know we can apply for it. We just need to see if they approve of our scope of work. And so they asked us for a quote for a press release, which I thought was a really good sign.
Very good sign.
But we haven't heard yet.
Yep. Oh, that'd be great. I'm excited that you're focusing on wastewater as well. There's a lot of projects that could get going that would help the economy. I mean, it just drives a lot of engineering, a lot of construction in the region. There's such a need. So I'm hoping with a new administration, we'll see more of that stuff coming through if we get one. So, okay.
Jess and I were at a SEDS meeting when a couple of people were talking about the unemployment fraud cases, and neither of us had heard about it. And the next week, I got a letter from the state asking if I had filed for unemployment.
No
and
kidding.
yeah,
Ditto.
who said
well.
that? I think it was because of the Marriott breach that because I have Marriott points, so that's where they took my information.
I can't. People put that kind of energy into doing good things.
I know. I think Tracy's next.
Yes, thank you, Tracy.
Hi, everybody. So I'm update you about the PPE, the bulk PPE purchasing program we started a couple of months ago. The idea was to help local businesses and towns reopen. We ended up serving 24 farms, 14 municipalities, all 5 school districts and 2 private schools, 16 nonprofits and 41 for-profit businesses. So a total of 100 different organizations in the county and a little bit into Hampshire and Hampden County. We spent the entire $50,000 you allocated for us. We have another $17,500 waiting until some of those payments come in and we can revolve a little bit.
Have we had any payments come in yet? Or is it just?
Sorry, Trevor, yes, we have had some.
Okay.
Part of our cash flow problem is that the items are dribbling in, a case of gloves at a time, a case of masks at a time, and people are saying, I'll just come pick it up when it all gets here. So they don't pay until it goes.
Understood. Yep. Thank you.
Sure. We have decided not to continue. We'll finish up with the orders we have right now, but we're not going to start at round 3. There are a few reasons for that. One is that we're not getting the items in any faster than people could order them on their own. We're also not getting them any cheaper because the businesses are putting everyone on an allocation. They couldn't do bulk purchasing for us. We actually have a representative at Staples who is great to work with. He put in a separate order for each organization on our behalf just so that he could get around the allocation rules.
Wow.
So really, we just placed 100 individual orders. We did the work for people, but we didn't get any bulk purchasing discount.
Gotcha.
People have been very appreciative, gotten a lot of nice emails, but as I said, they're holding their orders until everything comes in, which makes me think it wasn't necessary for them to open up. You know, they've been open now a month or so without what we have offered them.
Can you repeat that? What you were thinking? They needed that to open, but they opened anyways without it. Is that what you mean?
Yeah, I think they probably found PPE they needed in a hurry elsewhere.
Elsewhere. Yep.
Yeah.
Well, you know, it was worth the shot for sure.
Yeah.
I mean, it seems that way. And, okay.
So we have created a technical assistance document that's up on the web, and I emailed it to everyone who had participated, as well as it's going out through the chamber and CISA and the CDC. So it will tell people where we found the best prices, the name and phone number of the representatives we worked with, how you set up an account, that kind of stuff.
Okay.
And if things become scarce again, which they're starting to again because of the hot spots in the Sun Belt,
right,
And if we determine we can make a difference, we'll start it up again. But at the moment, we're going to cease the program.
Okay.
That's it.
Okay. Thank you, Tracy.
You're welcome.
Is Randy on? No, Randy Brochures, was he on tonight?
Andy had a death in the family and could not join us, I'm sorry to
so
say,
sorry.
but
Extender.
Lisa and I are here to
Oh,
go on in his stead.
okay.
So what I think maybe makes sense is if Lisa White can start, because that's how we actually have the slides set up. And we're here just to talk to you about what all the Cooperative Public Health Service and a few other parts of the COG have done. And now, of course, after I'm trying to share my screen, it's not here. So 1 second.
Well, I'd just like to say I'm pleased to be here with you tonight. It's so nice to see your faces and to recognize again the great work that the council and the committees of the COG are engaged in, and as well as our wonderful staff. It makes me proud to be here.
Yes. We feel the same about you.
Oh my goodness. All right, something is having a problem here. Hang on, folks. You're seeing the wrong screen and now I can't get out of it. One moment. Okay. Basically, all right, now
The
we
good
are
thing,
ready.
we're running way ahead of schedule.
Okay, good. Let me try again. It's interesting, the little things that sometimes work and sometimes don't.
Yep.
Okay. So we'll go right into it. Just wanted to give you a quick overview that we're talking about. We're starting with the things that the Cooperative Public Health Service Health District did during COVID. These are the members. The yellow members are the comprehensive members where we serve as your full health department. The green members, we are serving some portion of what your health department does. So for Conway, Deerfield, and Irving, we're the public health nurse, and they're just welcoming Northfield to that as well. And then in Berniston, we are everything but Title V and septic, Title V septic work. So we just wanted to go over with you what we've been doing for communicable disease management. And I will turn it over to Lisa. And Lisa, you just tell me when you want me to click.
Thanks. Let's go to the next slide. I'm going to focus my presentation with data that is limited to our health district. So I just want to be clear, we're not showing numbers or information about the wider area. And we're focusing our discussion on case follow-up related to COVID-19. And I just want to recognize that the virus has affected all of us in a continuum in significant ways, whether it's because of direct experience with the virus or effect on livelihood, as Jessica was discussing, or just changes in our daily life and the lives of our loved ones. And it will into the future. And these are also concerns of public health and our health district. What we're doing with COVID-19 is similar to the work we do year-round for the Board of Health mandated role of surveillance, reporting, and control. New words we're learning, and we hear a lot, are contact tracing, and that often refers to the actions of both individual diagnosed people and people who are identified as their close contacts, and follow-up in a general sense in surveillance and reporting and control of this virus. In most ways, the work is very similar, but in this case, we're also including aspects of isolation, containment of people who are infected or diagnosed with COVID, and quarantine, having people who are close contacts also be isolated. And that's very different. We've often talked about that in public health for many years, but this is the first instance since I've been working in the field since 2006, and as I understand, well before it, where I've seen isolation and quarantine used, certainly on this level. So what happens when a case comes to us and how it comes? We get reports of cases by labs that get sent to the DPH state lab and put into Maven, which is an online 24/7 system that we work within software. We also get input from physicians who give clinical diagnosis when there may be no test or equivocal tests or a test is waiting. We're checking Maven daily. We're responding to calls as they come in. And Phoebe showed a picture of our nursing team. I'll introduce Melanie and Meg further. Randy and Lisa also have done backup for our follow-up of cases. We work to reach out to the person who's gotten the diagnosis within the same day. We find out how they're feeling, we answer their questions, and we assess their needs, as well as giving them information of what to do. We notify the local Board of Health through our contacts as they have been designated, and we notify Shelburne Controlled Dispatch of the addresses of probable and confirmed cases. When we talk to a person who's been diagnosed with COVID, then we identify their close contacts, people who've been within 6 feet for longer than 10 to 15 minutes of that person since 48 hours before their symptom onset, if we can identify that. And then we call those people and we let them know that they have been identified as a close contact and give them information on what to do, which is essentially to be home for 14 days, not allowing people to come into their homes. That's the definition of quarantine, that's formal. And only to leave their house to seek medical help. And we also try to give them assistance to meet that goal. It must be very hard for some people to be in their homes that long. What do they need? Do they need medications? Do they need food dropped off? Do they need a thermometer? We've worked to make sure that people have that. And then we check back regularly with residents to assure that everything's okay. And if they've gotten tested, we do recommend by the guidance of DPH that all people who are identified as close contacts receive a PCR test as soon as possible. And then we follow through the end of their time in isolation or quarantine. Thanks, Phoebe. Next slide's fine. So this is, again, just showing our experience in the health district. Our work has been completed for 18 towns in Franklin County. 15 are members of the CPHS, and we've added Leverett, Warwick, and Wendell for COVID response only. We hired 2 part-time nurses, Melanie Zamoyski and Meg Birch. Melanie is a former EMT. She is a faculty member at GCC, and I've worked with her with the service learning projects for nursing students. She's an excellent, experienced nurse as well. And Meg Birch is also excellent and experienced. She's a school nurse at Conway Grammar School, and she's also a nurse school leader, and she has an epidemiology background. Our numbers within the district were that 194 cases came in that we investigated. They could either be through Maven lab result, they could be clinical diagnosis, they could be a resident with concerns of their own, or they could be a case of a close contact that was identified. Say a Northampton positive has close contacts, but one of them or more live in our district towns. Of that 194, 64 were confirmed or probable cases with a positive PCR or a clinical diagnosis, and they had 115 close contacts. 61 recovered. I want to point out that recovery in the case of COVID means that you have no fever, you've been 10 days at home in isolation, you have no fever for at least 72 hours without medication, and your symptoms that are acute with COVID are markedly improved. But I point that out to recognize that, unfortunately, some people experience problems after their active infection. They might be physical, or they might be emotional, but respiratory complications that continue, fatigue that is lasting, problems with mobility, and the trauma of having been through that experience are all considerations. Maybe I think I'm going to turn to you for budgetary discussion.
Okie dokie. So we wanted to talk a little bit about the work that's the funding that's paying for this, and also what other things we did. One of the things that happened early on is that the state selected us to be a COVID affiliate, COVID emergency response affiliate, they called it. And they gave out money both through that to us through that role, and also as the health district to work for our member towns. That money was largely intended to be for nursing. And so that is what most of it went to. But we also provided, so the internal money supported the 2 new nurses. We also provided grants to all the towns that were not in any health district. Oops, look at that. I did not fix this and put in the towns here. But that was like Sunderland, Greenfield, Montague, New Salem, Warwick, Wendell, and Leverett. And Leverett. And we've given out about $57,000 of that so far. We also reimbursed COVID costs for towns in the health district. So people came to us, Trevor was asking about this. We got, for instance, one town asked us to pay for increasing their code red coverage to do COVID communications. We've had a number of towns put in money to print posters or do mailings to every home, that sort of stuff. And that can come to me and I can reimburse that. And all the towns have a list of what is an allowable cost and what they can get reimbursed for, and they know how to go about doing that. We also provided a number of regional public safety messages, trail signs, newspaper ads, face covering signs that you have probably seen around. And we created a number of resource pages on the website, Word of Health information exchanges, where people can put out what is the messaging they are sharing and what are some posters and things that they're doing, so that communities can use each other's hard work. And then also a compendium of all the reopening guidance that's come out and enforcement information. Definitely, if there is a second surge, that grant funding is not intended to continue. And so the CARES Act would be what would be funding the work that the towns that all of these towns were getting supported through this funding. That's where that money would come from next time. And we are working very hard to identify some trainers who could come and give a webinar on exactly what kinds of public health expenses are appropriate to the CARES Act. We did get a $50,000 FY21 contract to continue to provide. We have regional meetings of the nurses, we have regional meetings of health agents, and these kind of regional production of signage. We're talking about making emergency dispensing site flu clinic signs and things like that. So that work is continuing, and definitely happy to answer questions, other questions when we get to the end. Now back to Lisa to tell you about the thing you've probably heard lots about in the media.
I wanted to talk a little bit about the Community Tracing Collaborative, a statewide contract that's designed to give back up to towns. And they have 1,500 employees, or did at the start of this organization coming online, Partners in Health. They do the work that I described to you step by step. And they've helped many cities that have had an explosion of numbers in managing cases through this first surge of COVID. We may need to use them in the future if a second surge does occur as things open up in our area. And I've been working to understand how that process would relate between the local boards of health and our nurses and and have been participating in 2 advisory committees of the CTC to try to assure that if the need comes, that will be a smooth and satisfactory response.
I did want to share one funny story, which is that the other day the mass COVID team called me and I was like, oh my gosh, because it says MA COVID team. I thought, I've been exposed. What is it going to be? And I picked up the phone and she said, I'm calling to tell you that because you're the contact for the town of Franklin Board of Health, I'm going to be your new contact. And I was like, oh, no.
The staff have all been very eager and well-intentioned, and the Mohawk Area Public Health Coalition invited them to a June meeting, as this slide describes, where we had both case followers, supervisors, and resource coordinators, people who make sure that people have what they need to get through in the room. And we've also sent them 4 cases as trials. It's been a learning experience, and we hope that they'll be there and be an asset to us as needed, because we have other work to do as fall rolls on, and we prepare for delivery of flu vaccine, which is also an exercise for many emergency dispensing site teams in how to deliver COVID vaccine when it comes available, as well as the ongoing public health needs that we try to work to address throughout the year. And we will maintain staff so that we can have flexibility to be responsive ourselves as needed. An important point with the CTC is that they do not cover complex cases, and in categories that they describe not covering are healthcare workers. And you may have seen in my earlier slide that most of our cases were healthcare workers. Congregate settings, that would include group homes, that would include boarding schools, and in our interpretation, schools in general. They also don't cover hospitalized cases or clusters. Another reason why I think schools would be in our bailiwick. So we will continue to be busy responding to COVID cases, but the CTC is an added resource that we hope to be able to maximize use of. And then I think this is the end of my slides, but I'll just close by saying, while we're watchful for a second wave, we're also continuing to work with our boards of health to answer many questions that are still arising on how to open safely and address containment and mitigation of the virus, and to assist the community as a whole to stay on track as things open up. Carolyn Shores Ness, who I'm sure you're all aware of as a public health leader in our region, and she's the chair of MAFCO at this time, calls these the 3 W's. Wash your hands, watch your distance, and wear a mask. And if we can keep the community at large on track with that, we can do a lot to keep ourselves safe. Thanks very much for having me.
Before we go on to the health kind of code enforcement stuff and reopening guidance, do people have questions for Lisa?
Just my main question or statement is just as I had a school committee meeting last night, as we try to kind of come up with plans for our region, Union 38, and I'm sure everybody else is trying to tackle this too, as to how to open. If we do open, how do we make sure we have infrastructure in place to make sure that we can be, really quick to catch something if it happens, how we're going to have some sort of testing or protocol in place. It's wicked complicated to figure out, and we're all just feel like we're just jumping off a cliff if we're going to start this thing, and we're so nervous to wind up looking like Florida, or we've done really well here in this region. So proud of Franklin County and Massachusetts in general, but certainly Franklin County has been wonderful. People are following the rules as best they can, and it's frustrating and hard, but it's working. So just nervous about that, really not sure where to go. That's all. So I appreciate that, being able to lean on you all for that help and advice.
Thank you.
We're all anxious about it too. And we are in conversation with the Community Health Center, who is doing testing of any resident who requests it, and Bay State Franklin, who is testing with a doctor's order and diagnosis, to be sure that there are quick turnaround opportunities for testing. And I am also concerned, Trevor, about what happens in schools. And I'm very thankful to have Meg Birch as a school nurse leader working on our team, as we review school planning and think about how case response goes in a classroom, given all the uncertainties and difficult issues that do arise as you're working to diagnose someone with symptoms.
There were a lot of unanswered questions about how it's all going to work with schools, for sure. Part of what I am doing is meeting 3 times a week with the DPH leadership. And so any questions people have that they feel like they don't have answers to and can't find on the website, you know, or just don't want to look through the mess of the website, well, feel free to call me. I'm happy to bring local concerns there. And that's a big part of what the role that we're playing is, to kind of hammer them on testing and vaccine and any number of things. You know, right. Giving the Board of Health a chance to look at stuff before they release it, all that. Any other questions for Lisa?
I would just, this is Bill Benbury. I would like to stress how important the data is to fighting COVID. And my real concern now being that President Trump's latest is to have all data bypass the CDC and go directly to the White House, where I think most people, probably reasonable people, understand that data will be publicized and the information not going to the states and to the people who need it. So I'm genuinely concerned that Massachusetts doesn't fall into that situation where data that's important to continue to fight the COVID gets lost in some political mire president. So
there is a good system set up right now within Massachusetts that I don't think could be short-circuited by that. And all the hospital presidents meet weekly with the command center. And then that data dashboard that comes out, have you guys seen sort of these 10-page thing that comes out weekly with all kinds of tracking, in addition to the daily tracking that they do on the state's site? I can send out links if you don't, or they're on our website too. But I share your concerns for sure. I think we have pretty good relationships here. We get emails from Bay State with their report, you know, every few days. So I don't think there could ever be a spike in hospitalizations here that we wouldn't know about.
Okay, thank you.
Confiscated all the Sharpies. So we're
okay, let me cover a little bit more of what we've been up to and see if you have other questions. These kinds of signs, I just want to say, if anybody wants them for your town and you don't have them yet, let me know. They come with little folders and they can go up all over. We have plenty of them.
You do? Okay, great. I'm glad you have more. I didn't know if you had some more left. Okay, great.
Yep, I do. Tons. Ask anytime.
We'll be in touch. Great.
So quick talk about what are our health agents doing at the same time. And Lisa Danik-Burke is here, who can wave, although you probably cannot see very many people and how you have the screen set up right now. But thank you, Lisa, for being here. And Randy is with us in spirit. So they've had a completely other angle of work to do, right? They're not dealing very much, except when we really need them to, with cases. They are primarily trying to stay on top of all of the guidance that is coming out. And it is an absolutely staggering amount of guidance that comes out from 5 or 6 different entities, at least at the state, if you count the Department of Environment and Energy and the DPH, the school people. It has been really something. Randy's been to more than 50 virtual Board of Health meetings since mid-March, and Lisa to another 10. They participate in twice weekly calls from the state where everybody gets on and answers questions. And then they spend a lot of time educating businesses. A huge amount of what they are doing is answering questions from businesses, as well as local officials and schools and other folks. But for instance, at the real darkest days of the lockdown, we had only about 15 of our 84 food establishments open. So there was all the closing down questions, and now there's all the slowly reopening questions, and there's the how do I shift to takeout, and how can I move my operation outside? So all that kind of work. Everybody wants to be safe, the businesses. And then we also get a lot of calls from people who think that people are not being safe and have questions. We share the role at local boards of health, and the Division of Labor Standards share the role of the place where you can call to complain. And as the governor recently sent that out in his press conference, there have been a lot more calls. We do want to just give you a sense of, here is one day's email of the kind of guidance that we need to then have the health agents click on and understand. And so this is just the phase 3, step 1 safety standards for outdoor and sport related things. And when you dig in there, you find that there are all of these little differences, like you can have no shower at a beach, but you can have a shower at a campground. So what if the campground is a beach? What do you do? For children's sports, you can have a spectator. For adult sports, you can't have any spectators. You can only have 100 spectators if there's kids. So there's just a lot to understand, and really Lisa and Randy have been doing amazing work on trying to keep up on all of this and answer questions and support boards of health in trying to answer the questions that people come to them with. And at the same time, of course, we have a lot of other work to do as well. But just to give you a sense of what the calls are that we're getting early on, as it says here, we got a lot of stuff about schools wondering how to close in daycares. Then about a month ago, all the summer camps were calling, please, 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 or, from 2 months ago to a month ago, what can you tell us? What can you tell us? And it was heartbreaking because we couldn't tell them anything week after week. And then when we did, we were able to tell them as you know, I think we have maybe one summer camp open in Franklin County this summer. I mean, it was a big deal. And there will be no residential summer camps until next summer. So that was a lot of people with a lot of questions as well. And one other thing to say here is that we are doing a review of all of the school reopening plans that they are developing and working with them on that. And we're getting, as you would not be surprised to hear in Franklin County, a lot of questions from youth sports leagues as well. How exactly can they do it? As you may know, the sports guidance is particularly complicated with 4 different levels of risk and 4 different levels of engagement and what is allowed when, and a lot of complicated different words used that all seem to mean should, but might not all mean should legally, like must and shall. And so there's a lot of work to be done there as well. And so those are the kind of people we're hearing from, and lots of restaurants. And then, of course, all this is taking place while we're trying to also make it so that people can sell their homes, build homes, open businesses. We've actually had a lot of activity online. Lisa has been out there. Lisa Danik-Burke has been out there doing an absolutely enormous amount of 24 new applications for septic systems, 29 soil evaluations, 10 new wells. A lot of people are moving to, is our sense from the realtors, to Franklin County because this showed them that living in the city was not that fun. We also, in terms of the other things that we're continuing to try to maintain moving forward while responding to COVID, is we did get a grant in the district to work on abandoned and distressed housing and to educate Board of Health members more, to develop an education program for our boards. So we've been focusing on the housing one because you can do that outside. So they've just completed both Gill and Buckland's abandoned and distressed housing inventory. And last week we had a meeting with a whole bunch of towns and the abandoned housing initiative from the Attorney General's office so that we could get towns on board with the tools that the AG's office offers. So that is what we have been up to, both COVID and not COVID. And Lisa Danik-Burke, did I miss anything that you think we should say?
No, I think you pretty much covered it all. I think the only thing I didn't hear you mention is we still have been getting a number of housing complaints. I think we've
Oh,
had
yes.
something like 6 recently that were critical enough that needed to be addressed, with something like 14 inspections surrounding those. So
Mhm.
it has been quite busy, and I think the significance too, with so many people home, their septic systems are getting used quite a bit more. So I think, you know, we're seeing people with failed systems, and so people trying to take care of doing that, and you know, as well, a lot of people, I think, doing projects because they're not going on vacation. So we're seeing a lot of, you know, every building permit that comes through needs to get reviewed to see whether or not there are well or septic issues with that. So we've seen quite a few building permits coming through as well.
Thanks. One thing I would say is, I mean, I've been a huge fan of boards of health since I was hired here to work with them in 1994, but my goodness, your boards of health are putting in such amazing work. I mean, so many boards of health are working so hard on all of this, and we could not do this without them. I mean, they're just an amazingly hardworking bunch of public servants. So that's the end of my slides, and I'm going to stop sharing this screen and see if you have any questions. Well, I think I'm going. Okay.
I had a question. Sorry for asking late. You said you're going to be reviewing the school opening plans. Does that include the arrival and dismissal situation?
Yeah, the plans include that, so I think we would be looking at that as well. Yeah, I mean, we're not the signer offer on arrival and dismissal, but there is instruction in the DESE guidance for every school to connect with its local board of health and get their input. So the plans, I believe, include that.
Do you mind if we connect offline so I can touch base with you regarding that?
Sure. Walker at frcog.org.
Okay, thanks.
So I have a question, Jane Pierce from Orange. As you know, I'm on the Board of Health, and we do not belong to your health district. So I'm curious about the level of support that those of us who don't belong to your health district can be expecting from your program, because you just named a lot of things that are news to me that we've been working on our own. And how are you reaching out to the boards that don't pay into your district, or how do you separate out that work?
So 2 things. We have calls pretty regularly with the health agents. And so Matthew, your health agent, has been on all of those calls, and we've done a fair amount of emailing each other back and forth and sharing resources. And then we have the funding that we provided to Orange, you know, to support various things. And I've been working with him to identify the whole time kind of what are the things that he could use and your town could use for funding, and what would he like to spend that money on, and how could I be supportive if he needed it. So other than sort of creating these regional opportunities for communication and collaboration, and creating these regional products that people can have if they want, the signs and things, and giving out the grants, that's sort of the thing that's available to everybody, no matter whether you're in the district or not. But if you have other ideas of things we could be doing, totally open to it. I think now that the extreme crisis is over for now, we have time to also think about moving forward what are other needs people might have.
No, I'm just thinking about the fact that we all belong, you know, we pay our dues to FERCOG, and I'm trying to figure out what is the base service that we receive without belonging to your health district.
So for local boards of health, the base service that you would receive as part of just being part of the COG is really trainings we do, you know, and information about stuff that's coming in, and workshop. Yeah, pretty much trainings and workshops is sort of what we provide for boards of health, and advocacy at the state level for trying to generate more funding and more grants that are available to towns. And also any town that wants to share services, not through our district, you know, we're fine to not have people join our district. We're available to help you plan with neighbors. So for instance, one thing that happened during this process is that all the towns that didn't have anybody on Maven, I got in touch with each of those towns to find out what would they like. Could we support a Maven nurse being created for their town? And I think at this point we do have plans and well on the way to implementation in Wendell and Warwick and New Salem So a lot of communities that didn't have MAVEN coverage before, we were able to help get that set up and lever it as well.
And are they're paying, purchasing in or buying into that service? Is that correct? The 3 towns?
The 3 towns who we covered for COVID, who were not part of the district, their COVID coverage was covered by the state emergency fund. Because what happened is the state, the first cases started to explode and the state looked around and said, oh, we actually never made sure that every town even had anybody on MAVEN. We've said it was mandatory for 15 years, but we've actually never checked whether anybody's on it. And we don't have public health nurses in many, many, many communities. So then they tried to figure out what do they do with these, hundreds and hundreds of communities where they don't know what to do. So they sent money out through the affiliates to do that work. So that was separate money from the district money that supported the nursing for your town.
Good.
And so, Jane, because of that funding that Phoebe just talked about, if there is more that Orange needs, we should definitely know about that, because we did receive funding to help non-CPHS towns. So please call us and talk to us about your needs.
Yeah, thank you. We will. And I am not with Matt every day, so I don't know what his correspondence has been, but it just struck me that Phoebe named a whole bunch of things that I've been thinking we were working on by ourselves that doesn't make any sense if you are also doing it. The school closure one being a major issue for us.
Yeah. We're doing a lot of really good cross health district connections between the Foothills Health District and Eastern Franklin, and Matt has been really engaged. It's been really nice to work with him. So definitely, if you have other thoughts, he's been great about bringing things up, but if you have other thoughts, do call. Any other COVID questions? I maybe wanted to just say one thing about testing, because it's such a hot topic right now. We're really fortunate in Franklin County that we actually do have 2 places you can get testing, even if you don't want a doctor's order or health insurance, which is both Tuesdays at the Community Health Center in Greenfield and Fridays in Orange at the Community Health Center. And then Bay State Franklin has a drive-through where you do need a doctor's order, but the doctor's orders are not incredibly hard to get. So we're in a better shape than many other places. It can take up to 5 to 6 days to get the results of the ones from the Community Health Center back. I will warn you that there's a lot of pressure going on, is what I'm hearing across the state, from people who want to go on vacation and have been told that they need a test to go where they're going, and you can't get it back really quickly. So just note that. And I note that as the Sun Belt, as the other states are really starting to struggle, it's slowing down the response time for folks that are using Quest as a lab to do the testing. So the testing is going to be a huge issue for us and continue to be a huge issue, but right now we're in pretty good shape.
And I was wondering how we, in this month or so, how do we bolster that support, or is there anything we can do to, because I know as soon as schools open, there are going to be requests for tests, and there's just going to be a huge influx of needing testing, either for people who are actually sick or may just have the flu, or there's all kinds of confusion that goes on in the early days of school. Is there anything that we can do? Is there any pressure we can put on the state, or is there the state's looking to beef that up?
I mean, I think it would not hurt to be back in touch with both the administration and the legislation about what's the testing plan. What is the surge capacity? Just like we had all those early PPE, frantic midnight, airport trips that we heard about. What are they going to do when there are 20,000 people or even 10,000 at UMass, and they need testing. All of schools, all colleges are planning for, lots of testing. And I don't know, and I have asked and will continue to ask, what is the actual plan to make sure that the private sector labs are ready for that capacity. So my short answer is tell the lieutenant governor you're concerned about that, and tell your, senator.
Yeah, because you're not seeing any federal, no federal help coming in to go, we're going to do a you know, we're taking over, we're going to force private entities to do this stuff, and we're going to force, you know, testing to happen. That you're not seeing that, right, from the federal government at all. This is mainly state. Yeah.
Correct. Well, the testing in Massachusetts is and just as it is, I think, across the country, is not it's not being done by governments. It's a private sector enterprise. So
Sure.
it's really, can our government make sure that CVS and Quest and other people are there for us when we need it? And I think that's what they're trying to figure out.
Yep. Thank you.
Sure.
So any other business to attend to tonight? Not reasonably.
Yes, just one thing. I would like to thank our outgoing chair for her service.
Oh, thank you.
You're welcome. I don't know how we missed that. I think the virus is getting all of us down.
Yes, thank you.
I meant to say that too. Thank you, Michelle. And kudos to Trevor. We try to end by 7 o'clock and it's 6:55. So
There you go, right?
Michelle, I don't know. What do you think of that?
Pretty good. Pretty good.
Going.
I did have some quick business, real quick. We are hosting a webinar. It's mainly for like school personnel, but I just want to announce it. I put it in the chat. It's called Student Travel in a COVID World, Planning and Discussion for the Fall with Help from Massachusetts Safe Routes to School Program. So I forwarded it to Phoebe Walker since she's more directly associated with the schools. But it's going to be next week on July 30th. There's going to be 2 sessions, 10 a.m. and 2 p.m. So I'll post it in the main chat as well. So just so you guys have a heads up.
Great.
Thanks.
Great.
Well, thank you all very much. And
Thank you, everyone. It's hard
Thank
to have a
you.
meeting this size by Zoom. I appreciate your attendance.
All right. Bye.
So,
Bye.
motion to adjourn. Do we?
Bye. Oh yeah. So moved.
All right. Thank you. All those in favor? Aye.
Aye.
Second.
Right. Have a good night.
Good job,
Have a good
Kevin.
weekend, everybody.
Aye.
Thank you. Thank you.